Why operate when you can regenerate? Medically, the solution to joint pain has been a two-step approach. First, mask the pain with anti-inflammatory drugs, cortisone injections, and painkillers, and when that is no longer possible, joint replacement. Joint replacement, a temporary solution itself, is invasive and requires a long, uncertain recovery. How big is this problem? Well, in 2017, almost 900,000 people in the United States underwent knee and hip replacement. American joints are in need of a remedy more reliable and more sustainable. Stem cell therapy has especially proven effective as an alternative to surgical joint replacement. The beauty with stem cell is that they have the ability to become any tissue. If you inject them into a joint, they can start to differentiate as joint cells to repair the joint. If you inject them into a tendon, they can start to differentiate as tendon cells, into ligament cells, and so on. In addition to being able to become any tissue, they also secrete a soup of growth factors in the area where they are injected. These growth factors accelerate the regeneration of the tissue, in addition to signaling to neighboring stem cells to join in the repair. With what type of injuries have patients benefited from stem cell therapy? Well, the list is pretty long. Knee injuries, arthritis, osteoarthritis, hip or labral tears, shoulder damage such as rotary cuff, tendonitis in the shoulder, chronic neck pain, chronic back pain, wrist, elbow, and ankle damage and pain, Achilles, foot pain, plantar fasciitis, lower back pain, bone fractures that don't heal, pain derived from diabetes. Essentially, if you have damage to a ligament or lingering pain in a specific area of your body, stem cell therapy can help. It is the best non-invasive regenerative therapy available and a groundbreaking advancement. If you feel that you can benefit from stem cell therapy, give us a call to schedule an appointment with our physician to see if it is right for you.